Performing wound dressing. Applying or changing wound dressings must be done aseptically to prevent the wound from getting infected or even more infected. To perform wound dressing, you will need the following: a clear available work surface, spacious enough for the dressing pack to be opened on, a sterile dressing or procedure pack, a nearby hand washing sink or alcohol hand wash, non-sterile gloves to remove old dressing, sterile gloves, appropriate dressings, and the appropriate solution to clean the wound if necessary. The wound dressing procedure is divided into 3 parts: preparation, removing the old dressing, and cleaning and dressing the wound. Preparation. Introduce yourself to the client and explain the procedure and its purpose. Provide privacy where needed.
Good morning, sir. I'm Aljon, your caregiver, and I'll be changing your wound dressing today.
Why? I'm fine.
We need to change the dressing because we don't want to get the wound infected. I'll be preparing the materials I need first. Then, I'll remove the old one. I'll check if the wound is healing nicely. Then, I'll clean the wound, put medicine, and dress it again.
Before starting the procedure, put the client in a comfortable position and in a clean and tidy area. Refer to the client's care notes to check if there have been changes in the client's condition and if the wound dressing needs to be changed already. Perform hand hygiene. Make sure your work surface is already clean prior to this procedure. Wear your gloves. Put the sterile dressing or procedure pack on top of the work surface. Open the sterile dressing pack using the corners of the paper. Open other sterile items without touching them. Removing the old dressing. Wash your hands and wear gloves before removing the old dressing. Dispose the old dressing in the kidney basin. Perform wound assessment. If there is no improvement, report this to the attending physician or your supervisor for further evaluation and modification of the care plan. Cleaning and dressing the wound. Choose the appropriate dressing type and materials that are best suited to the type, size, and location of the wound. Refer to the care plan or the doctor's or nurse's recommendation. Wash your hands and wear your sterile gloves. Gloves must be sterilized at all times. Otherwise, remove them. Wash your hands again and wear a new set of sterile gloves. If resources are not available, you may wear non-sterile gloves to protect yourself. Then wash your hands or use alcohol gel with your gloves on to protect the client. Clean the wound. Beginning from the least contaminated area, then moving on to the most contaminated one. Do this carefully since there may be tenderness on the skin or tissue, or there may be sutures in place. Make sure to not cause further damage and disgrace to the client. Do not overuse cleaning materials such as gauze and cotton balls. Doing so might reintroduce dirt or ooze to the wound. Change the cleaning materials regularly and if possible, use them once only. Make sure to not touch contaminated materials to the clean area. Double check if you have the correct dressing for the client's wound. Dress the wound as instructed. Once the wound has been dressed, make sure that you dispose of all soiled materials and practice proper infection control. After the procedure, fold the dressing or procedure pack and dispose of all contaminated materials in a plastic bag designated for clinical waste. Remove your gloves and throw them in a waste bag. Wash your hands thoroughly. Clean the work surface with soap and water or disinfectant solution. Document your wound assessment, dressing change, and given care to the client's chart. Give the clients a briefing on dressing management and answer their questions before leaving. Report any changes to your supervisor or the attending physician.